In our second video for the overhead squat analysis, we're gonna cover what to look for. Now, the overhead squat can get pretty complicated and sometimes people get very overwhelmed with how many things there are to actually see and a lot of dysfunction that can come about doing the overhead squat. But when you really break it down, which is what we wanna do right now, we're gonna chunk this out. So we're gonna look for a few things on the feet, a few things on the lumbo-pelvic hip, a few for the knees, and a few for the shoulder. And in our later videos, we're gonna break these down each individually so you can clearly identify what's causing these issues and what to do. So Sarah's gonna come over here and we're gonna start from the bottom and we're gonna work our way up here. So a few things, so making sure, straight ahead for us. So let's go through our setup one more time. We gotta make sure that the feet are perfectly straight, arches, feet in line with hips, feet parallel. Knees tracking over the second toe. We got pelvis properly set, TVA set, arms over the head. Now for now, I don't want you to worry about anything here. We're just gonna be looking at the feet. So when you instruct your client to start doing their overhead squat, don't get too concerned looking for everything. Just focus on one thing at a time. Now Sarah's gonna come down into our squat and we're only gonna be looking for two things. Do her feet flatten and do they start to turn out? Come back up for me. So we're gonna do this a few times, get down as low as you can. Now we can start to see these feet, those heels start to come in and those toes start to come out. That's the first things that we wanna look for. Also, when we're looking at the arches, come down, I'm gonna be paying special attention right here, seeing if those flatten. In this situation, it doesn't. So first step, client comes in, they're going through their squat, just look for these two things. Any of these two things occur, boom, we check it off, and we'll cover this in the next couple videos. Next, let's look at the lumbo-pelvic hip. And for this situation, Sarah's gonna turn for us. Good. Making sure all those other things are still in check. Feet, toes, knees. Good. Set the pelvis. And now in this position here, we're gonna be looking for a couple of things. We're gonna be looking at something called the APT, or the anterior pelvic. This occurs. That creates a very excessive curvature in the lower back. We're also gonna be looking for any excessive leaning, and we're gonna be looking for any asymmetrical weight shift and some hip tucking. These two right here, we're gonna be looking at from the side. So as Sarah starts to squat down, if you notice this excessive lean starts to get created, and that pelvis starts to rotate. And that's gonna be something that's natural that she's gonna be doing. We're gonna cover this. So this will be one form of a dysfunction. The second thing that we're gonna look for as well is the excessive lean. What we should have, come down for us as far as you can, try to break parallel, down, 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 down. Notice what starts to happen. Keep going, keep going, keep going, keep going. Now this angle right here, your tib angle and the angle of that torso should be parallel. And we're gonna cover this a little bit more when we break this down. Now stand up for us. Now turn around and back towards the camera. We're gonna be looking for any asymmetrical weight shift, meaning does her hips move to one side or the other? So again, hands up for us, and slowly come back down, and we're gonna be looking for any kind of shifting. So just kind of play with us, go to one side, any of this, come back up, or to the other side as it comes down and favoring one side. Lastly, turn around this way again, we're gonna be looking for any hip tucking. Commonly known as the butt wink, which I absolutely cannot stand that term. We use the word hip tuck. And this is where, as you start to come down, squat down, squat down, squat down, that hip or the butt starts to tuck underneath. And you'll notice this, if someone has really poor hip flexion, also ankle issues, you'll notice that hip starting to come down. Next, we're gonna be looking at the knee, so facing the camera again. As she comes down, do the knees bow in or the knees bowing out? So slowly come down, bow the knees in a little bit. We're gonna be looking for this. Come back up. Also, bowing out does not have to be excessive. Even if that patella is going over that third or fourth or fifth toe, that would constitute knees bowing out. Lastly, we're looking at the arms. So from the two angles we're gonna look at right now, bring the hands up again. We want to be able to hide the ears. So as the hands are in this position, if you notice, they're going to be covering the ears. As Sarah squats down, go ahead. We want to make sure that those hands stay blocking the ears. Now, one tip I recommend, don't tell your clients what you're looking for. Are you forcing your hands in that position? Or are they naturally in that position? Naturally. Okay, so come back up for a second. A lot of times what will happen is if you tell your clients what you're looking for, they're going to try to force that joint in that position. I want to see what's naturally happening here. The last thing with the shoulder is going to be any elevation. So as she starts to squat down, go ahead. Do those shoulders start to elevate? So bring those shoulders up. Does that start to happen? Okay, good. So as you're preparing yourself for overviewing the overhead squat, make sure all you have to do is start from the bottom, work your way up, and just check off your boxes.